5 body parts that itch before cancer. Shows up. Video script opening hook. Your body might be screaming at you right now, and you don't even know it. That annoying itch you keep ignoring. It could be cancer trying to get your attention months before any other signs. Show up. I'm not trying to scare you, but I need you to pay attention. Thousands of people over 60 miss these early warning signs every single day. They think it's just dry skin, old age, or nothing important. But doctors have seen the same pattern over and over again. 5 specific body parts start itching before cancer appears anywhere else. And today I'm going to show you exactly where to look and what to do about it. Don't click away. This could save your life or the life of someone you love. Introduction. Here's what most people don't know. Cancer doesn't always start with pain or lumps. Sometimes it starts with an itch. A weird, stubborn itch that won't go away no matter what you try. The cancers I'm talking about include blood cancer, pancreatic cancer, breast cancer, and skin cancer. These are serious diseases, but they're much easier to beat when caught early. In the next few minutes, you'll learn exactly which body parts to watch, how to tell the difference between normal itching and cancer warning signs, what to say to your doctor, real stories from people who caught their cancer early because they paid attention. This isn't about panicking. This is about being smart. Your body talks to you every day. Today, you're going to learn how to listen. Sign number 1, your lower legs won't stop itching. Let's start with the first warning sign. If your lower legs, especially your shins and calves, have been itching for weeks and nothing helps, pay attention. This isn't normal dry skin itching. This is different. It feels deep, like it's coming from inside your leg. It gets worse at night. Lotion doesn't help. There's no rash, no bug bites, nothing you can see. But here's the scary part. This type of itching can be your first sign of blood cancer, especially lymphoma. Why does this happen? Blood cancers start in your lymph system. Think of your lymph system like your body's cleaning crew. When cancer cells grow there, they release chemicals into your blood. These chemicals irritate your nerves, especially in your lower legs. Meet George's story. George was 75 when his legs started itching. For 6 months, that was his only problem. His doctor thought it was dry skin or maybe laundry detergent. George tried everything, different soaps, creams, even threw out all his pants thinking they were the problem. Nothing worked. Finally, his doctor did blood tests. George's white blood cells were all wrong. More tests showed swollen lymph nodes in his chest. The diagnosis? Lymphoma, George said later. The itching came first, months before anything else. I wish I had known. What makes this different from normal itching? Normal itching has a cause you can see or remember. New soap or lotion. Bug bites, dry, flaky skin, rash or redness. Cancer itching is different. No visible cause, lasts for weeks. Gets worse at night. Doesn't respond to creams or treatments. Feels deep, not on the surface. What should you do? If your legs have been itching like this for more than 2 weeks, especially if you also feel tired, have night sweats, or have lost weight without trying, call your doctor. Ask for blood tests. Mention the pattern. Don't let anyone brush you off by saying, it's just dry. Skin without checking first. Remember, your body often whispers before it shouts. Listen to the whisper. Sign number 2, that itch between your shoulder blades. The second warning sign happens in a place you might never think about, right between your shoulder blades, in the middle of your upper back. This isn't the kind of itch you get from a scratchy shirt or sleeping wrong. This feels like it's coming from deep inside, like you can never quite reach it no matter how much you scratch. This specific type of back itching can be an early sign of pancreatic cancer. How is this possible? Your pancreas sits deep in your belly, behind your stomach. When tumors grow there, they can block tubes that drain fluid from your liver. When these tubes get blocked, certain chemicals build up in your blood. These chemicals irritate nerves all over your body, but especially in your back where you have lots of nerve endings. Linda's wake-up call. Linda was 70 when she developed what she called a phantom itch on her upper back. She would wake up every night scratching the same spot. She tried new mattresses, different pajamas, back scratchers, special creams. Nothing helped. She said it felt like the itch was coming from inside her body, not from her skin. When Linda went to the doctor for feeling tired, her blood tests showed liver problems. More tests found a small tumor in her pancreas that was pressing on important tubes. The scary part? That back itch was her only real symptom. No stomach pain, no yellow skin, just that annoying itch she couldn't shake. What makes this back itch different? Normal back itching usually has an obvious cause. Dry skin you can see, new soap or laundry detergent. Scratchy clothing, sweating or heat. Cancer-related back itching is different. Poo, focused in one specific area. Feels deep, not surface level. Doesn't respond to skin treatments. Keeps coming back to the same spot. Often worse at night, red flags to watch for. If your back itch comes with any of these, see a doctor right away. Dark-colored urine, light-colored or clay-colored stools, feeling more tired than usual, losing weight without trying, don't wait. Pancreatic cancer is serious, but it's much more treatable when caught early. Sign number 3, your scalp itches but looks fine. The third warning sign happens on your scalp. Now everyone gets an itchy scalp sometimes, but I'm talking about something different. This is an itch that doesn't make sense. Your scalp looks fine, no flakes, no redness, no dry patches, but it itches constantly. It might feel like tingling, crawling, or even burning. You tried different shampoos, but nothing helps. This type of scalp itching can be an early sign of blood cancers like leukemia or skin cancers growing on your scalp. Why does this happen? In blood cancers like leukemia, your body makes too many abnormal white blood cells. These cells release chemicals that cause inflammation throughout your body. Your scalp, with all its nerve endings, often feels this inflammation first. For skin cancers, the cancer cells irritate the nerves in that specific spot, causing itching before you can see any visible changes. Henry's experience. Henry was 73 when his scalp started itching every afternoon. He thought maybe it was his hat, so he stopped wearing hats. Then he thought it was his shampoo, so he tried 5 different brands. Nothing worked. The itch didn't move around. It stayed in the same general area. It didn't look like anything was wrong with his skin. When Henry got blood tests for feeling tired, doctors found way too many white blood cells. A bone marrow test confirmed early-stage leukemia. His itchy scalp had been the first and only. Warning sign. How to tell the difference. Normal scalp itching usually comes with visible flakes or dandruff, dry, tight feeling, redness or irritation you can see. Gets better with the right shampoo. Cancer-related scalp itching is different. No visible flakes or redness. Feels like tingling or burning. Doesn't respond to any products. May move around from spot to spot. Often feels like something crawling. What should you do? Ask someone to look at your scalp carefully. If there's no visible cause for the itching, and it's been going on for weeks, see a doctor. This is especially important if you also feel more tired than usual, bruise easily, or just feel off in a way you can't explain. Don't assume it's just aging or dry skin. Trust your instincts. Sign number 4. Itching on your chest or breast area. The 4th warning sign affects both men and women, but it's especially important for women to know about. Persistent itching on the chest or breast area, particularly around the nipple or just under the breast, can be an early sign of breast cancer or inflammatory breast cancer. This is one of the most overlooked warning signs because it often shows up before any lump does. What makes this dangerous? Inflammatory breast cancer doesn't follow the rules. It doesn't always create the round lump most people expect. Instead, it can make the skin feel warm, look slightly red, or feel thicker than normal. But often the only symptom is itching. Ruth's story. Ruth was 69 when she noticed itching around her right breast. She tried different bras, changed her laundry detergent, even went without a bra for weeks thinking it was friction. Nothing helped. The itching stayed in the same spot every day. Finally, at her regular checkup, her doctor noticed slight dimpling in the skin and ordered more tests. They found a small but aggressive tumor growing close to the skin surface. There was no obvious lump, just that persistent itch that wouldn't go away. For men too, men can get breast cancer too, though it's rare. Male breast cancer often shows up as an itchy patch near the nipple, thickened skin, or persistent discomfort under the chest muscle, because men don't expect breast cancer. These signs are often ignored until it's too late. What to look for? Normal chest itching usually has a clear cause. Sweaty or tight clothing, new soap or detergent. Heat rash or dry skin you can see. Cancer-related chest itching is different. Beating stays in the same spot. Doesn't respond to moisturizers. May come with skin that feels warmer or looks slightly different. Doesn't move around. Keeps coming back. Take action. If you have persistent itching in the chest or breast area that doesn't make sense, don't wait. See a doctor, especially if the area also feels warm, looks slightly red, or the skin texture seems different. Early detection saves lives, and it often starts with paying attention to small changes that seem out of place. Sign number 5. Itching in private areas. The fifth and final warning sign is one nobody wants to talk about, but it's crucial you know about it. Persistent itching in the anal or genital area, when there's no obvious cause, can be an early sign of cancers in those areas. I know this is uncomfortable to discuss, but ignoring it could be dangerous. Why people ignore this? Most people assume this type of itching is poor hygiene, reaction to toilet paper, hemorrhoids, normal aging changes, just embarrassing and not serious. But when itching in these areas becomes chronic and doesn't respond to normal treatments, it needs attention. Eugene's experience. Eugene was 76 when he started having what he thought was hemorrhoid irritation. For almost a year, he used creams, changed his diet, tried cold compresses. The itching never fully went away. Finally, a specialist did a proper exam and found a small lesion that turned out to be early-stage cancer. Eugene said later that he wished he had spoken up sooner instead of being embarrassed. For women, vulvar cancer becomes more common after age 60. One of its earliest signs is recurring itch on or near the outer genital area. The skin might feel rougher or look slightly different, but often itching is the only symptom. Many women assume it's hormonal or related to menopause, and sometimes it is. But if the itching is relentless and doesn't respond to normal treatments, don't dismiss it. What makes this serious? This part of the body has lots of nerve endings, so it often signals internal changes before more visible symptoms appear, whether it's changes in skin cells, nerve inflammation, or swelling in nearby lymph nodes. Chronic itching here can be a red flag. Don't be embarrassed. I understand this is embarrassing to discuss, but silence is more dangerous than curiosity. Speaking up about persistent itching might lead to early detection and much better outcomes. If the itch doesn't go away with normal treatments, let a healthcare provider take a look. Catching something early often starts with noticing something small and choosing not to ignore it. A final message. Your body is always trying to communicate with you. Sometimes it speaks through pain, sometimes through fatigue, but often it begins with something small and subtle, like a persistent itch that keeps returning to the same place. The 5 areas we talked about today aren't random spots. They're places where serious internal problems, including certain cancers, often send their first quiet signals. You don't need to live in fear. That's not the point. The point is to empower you and remind you that your instincts matter. What seems like a small symptom might be your body asking for help. Remember these key points. 1. Cancer itching is different from normal itching. 2. It doesn't respond to usual treatments. 3. It stays in the same place. 4. It often gets worse at night. 5. It comes with no visible cause. Take action. If any of these signs felt familiar, don't brush them off. Talk to your doctor. Start a conversation. You deserve answers and peace of mind. The earlier you catch these things, the better your chances. Don't wait for pain or obvious symptoms. By then it might be harder to treat. Listen to your body. Trust your instincts. Speak up when something doesn't feel right. Your life is worth a potentially awkward conversation with your doctor. Thank you for watching. Please share this information with people you care about. Early detection saves lives, and it often starts with simple awareness. Stay healthy, stay alert, and remember, your body is on your side. Learn to listen to what it's telling you